Healthcare reform will have an impact on all of us. As the components of the Affordable Care Act are implemented, employers like you have plenty of questions. As many of you know, the law itself is an evolving target with a series of deadlines and requirements. The time is now for businesses to plan for the complexities and requirements that the implementation will bring.
This is an opportunity for us to all get more engaged in our own healthcare and to help start informing our employees about what are the tools and resources that are out there. We've got Checkpoint and Pricepoint and other tools that are available for consumers and for your employees to use to understand about quality scores, to understand about prices, and there'll be more information through the exchanges as well. So I think just educating employees is going to be really important.
It's something that's noteworthy, although we haven't seen the actual rates come out. What we know about rating and community rating in general is that the ratio between, say, a 21-year-old and a 64-year-old will be no more than 1 to 3. So for those of us who have gray hair in this audience, we may actually like what we see come out as of October 1st. If I'm a 30-year-old entrepreneur, I might not like it so much.
Those that are older are going to see less impact or maybe even a positive impact. Those that are younger are going to see a really significant impact. This doesn't work all that well if we collectively don't enroll a lot of those younger people, and their premiums are going up significantly. So if they are able to get a subsidy to help mitigate that to some degree, then it's less of a concern. But as much as they don't, there's going to be some sticker shock associated with it on the younger folks, and hopefully we can find a way to keep them enrolled and in the system.
What I think small employers will start to look at, especially when these premium changes kick in for 14, they will look at, why am I offering insurance? Do I need to continue to do this? And am I harming my employees potentially by offering them affordable insurance when they might be better off on the exchange economically? Again, not considering different options on the exchange.
Someone who is self-employed is going to be very appreciative of the fact that on the exchange, what we formerly thought of as applicable only to the group health plan sponsored by employers, and I'm thinking of the HIPAA protection prohibiting pre-existing conditions or discriminating on the basis of a health factor. That used to be just fine in the individual market. That's why individual market premiums have been higher, and they're harder to get. The policy coverage has been harder to get. It's going to be much easier for a self-employed person with any kind of a health history or issue at all to get coverage now. I think that's a positive result.